I'd like to welcome ACS members to the American College of Surgeons Pathways to Fellowship interview series. I'm Lindsay Kilgore, a breast surgical oncologist at the University of Kansas Cancer Center and the current chair of the Associate Fellow Committee for the American College of Surgeons. The committee has developed this new fellowship pathway series to spotlight surgeon leaders who have championed the pathway to fellowship for young surgeons. The goal of the interview is to help promote the value of fellowship within the American College of Surgeons and among its members, especially those in subspecialty fields of interest. This interview will be published in the Resident and Associate Fellow newsletter and will be made available as a podcast accessible from the ACS website. Joining me in conducting this interview today is Medical Student Committee member Quinn Lasewski. Quinn, would you please introduce yourself?
I'm Quinn Lasewski, a medical student at the TCU and HSC School of Medicine, and a member of the American College of Surgeons.
Great. Dr. Mouad, we'd like to begin this interview. Can you please tell us a little bit about yourself?
Yes, thank you. And first of all, thank you so much for having me involved in this endeavor. My name is Nick Mouad. I'm the chief of vascular and endovascular surgery at McLaren Health System in the Bay region in Michigan. I'm also associate professor of surgery at Michigan State University. And I've been a member of the American College of Surgeons since my medical student years.
Great. Well, we are honored to have you here, and we know that you've been heavily involved in the college, so we're excited to see what you have to say.
I appreciate that very much.
Dr. Rowe, would you please introduce yourself?
Hi, I'm Vincent Rowe, professor of surgery here at the University of Southern California, Keck School of Medicine. I've been involved with the American College of Surgeons now for probably 19 years, and feel it's been very fruitful for my career and for the benefit of our trainees in this moving the field of surgery forward. So thank you for having me.
Well, thank you both so much for joining us. We are truly honored to have both of you and your knowledge and expertise. So I'll go ahead and get started with some of our questions. What does ACS Fellowship mean to you and to your institution?
Well, for me, ACS Fellowship, I think the key portion of the question is fellowship. And if we can use that term as a gender neutral term, I feel that it means that we're all together as surgeons. We're all together in a group, a collegial group, looking to solve clinical problems, looking to advocate for our specialty, and looking to advance the science of surgery in particular. So to me, it just means a very collegial group of people that are working together for one common goal.
The value of membership in the American College of Surgeons is extremely important to me and to our institution. Like Dr. Rowe said, I believe it's the pinnacle of being involved in the house of surgery. I think it allows us to be able to work on behalf of our patients, help support any clinical programs, as well as quality and advocacy for our patients in that particular endeavor. Importantly as well, just the value of the college to me is to be able to develop strong working relationships with a lot of other surgeons, but also help to foster some lifelong friendships that I've built over the years. I've been involved with the College of Surgeons ever since I was a medical student, and I'm very proud to be a continuing current member.
How has affiliation with ACS helped your career path and helped you as a specialist?
I'd say that the affiliation with the college, first of all, as a resident, let me know the interest of different specialties. You know about them by rotating in the hospital. You may have another friend that's in a different specialty as you, but by going to the college early on, you get to see the interaction and the diversity of all the specialties, even the subspecialties within certain specialties. So not just the colorectal surgeon, but the colorectal surgeon that specializes in inflammatory bowel disease. And you get to see that by interacting with people at the college. It let me know as a resident that I need to move forward in my specialty once I decide, and be involved and also contribute so that I can be an example for others like they were for me.
I agree with that. I think being involved with a college in that particular manner reminds us over and over again that our patients aren't pathologies. They're actual people. And so the goal of being involved in the college reminds us that we're taking care of a surgical patient. And so all of us are here on behalf of the patient, and we can learn that despite being in different specialties and taking care of particularly different parts of the body, overall, our focus is the surgical patient. We want to be part of the house of surgery because we're all intertwined one way or another. And I believe the college does a really fantastic job of dedicating themselves to the highest quality standards, commitment, and care on behalf of the surgical patient.
I 100% agree. So how have you all championed ACS fellowship at your institution and within the vascular surgery subspecialty?
Well, for me at the institution, I was the section 3 of the person that did the interview for the college. And also I was the president of our local society for the Southern California chapter of the ACS. I worked all the way through to be the president. So it was mainly word of mouth through encouraging people to join. And then as we had the interview process, encouraging them to join the local chapter, as well as to attend the national meetings, and any other person in our group or in the institution that was not part of ACS, encouraging them to consider fellowship. So I was always, my advocacy was more word of mouth by having those 2 positions and working my way up to that position in the local chapter.
I've been very involved in the college, like I said, from when I was a medical student, as a resident member, and ultimately becoming the resident and associate society chair of the American College of Surgeons before being an associate fellow, and now being involved with the YFA, or the Young Fellows Association. I also was, or I actually am, the chair on the committee of applicants for our district in Michigan, District 2 involvement. And similarly, word of mouth, really trying to let everybody understand the value of membership. For us, or for me, that FACS designation was, just as important as passing my boards. I learned that from my mentors early on. That's what I wanted to achieve, because it really puts you in a category and almost a credential of high quality, high dedication, and high commitment to the surgical patient. But a lot of it's been involved primarily with word of mouth, and maybe a little bit different than Dr. O nowadays, a lot of social media as well, teasing, but and that has also definitely helped. And I continue to learn that from my younger trainees.
Well, that's exactly why we're doing this interview series, is for word of mouth and to get the word out there about the college and why it's so important and beneficial to get involved. So again, this is why we're doing this, and we're glad that it's helped you guys over the years, and hopefully we'll continue to do so.
What would you tell your 20-year-old self at the beginning of your career about fellowship in the ACS?
I would tell myself to make sure you attend as many meetings as possible. Use the rule of try to meet 3 to 4 people while at the meeting, people that you don't know. I've heard the number get as high as 5, but I probably wouldn't be that hard on myself. And keep in contact with those people, because you never know how your career will meander through surgery. And so you want to be able to have people that you can discuss things with, mentor, be a mentee, and maybe scientific collaboration as you move through your career. So I would say go to the meeting and network, and make sure you stay in contact with people.
Yeah, I agree. I think you should first take the step to be involved. I know you're early on in your career, you're worried about your medical education, your resident responsibilities, you're an intern, you have a lot of things that you're worried about, you need to study and so forth, but they make it very easy to be involved early on. And most programs support you going to the annual meeting, and there's a lot of educational material. So I think don't be bashful to be involved early on. Everyone's very open, everyone's very supportive, because again, we're here on behalf of the patients and on behalf of the specialty. When I look back at my trajectory, I think I'm very happy the way I did it, but I've been involved with it from being involved in it from early on. And I would do it the same way again. Like I said, I've got to meet a lot of people, people that I never thought I'd have the opportunity to even talk to, giants in surgery, leaders of the college and so forth. And it's, very nice to be able to talk to them. Everyone's very open and everyone's very collegial. And that kind of networking and that kind of back and forth discussion is important. And I really do cherish that. And it's being a vascular surgeon, again, it's not just for specialties. You get to meet people from other specialties at the college and other leaders in other specialties in the college. And I think that makes it very nice. So I would urge everybody to be involved and I agree with Dr. O, try to meet a couple of people at the meeting. It definitely won't hurt you moving forward in your career.
I 100% agree. The networking that the college has, the resources that they have for everyone in all the different phases is incredible. So to kind of wrap things up, what are 3 takeaways for our surgeon colleagues on how they can address their career path and membership in the American College?
I would say 3 takeaways to address your career and networking within the college will be 1, it will be sustainable. The college is going to be there. The college is our voice for advocacy. And so the persistence and the movement of the college is going to be there. It's not going to wane away. It's not anything that's going away anytime soon. And so your work in the college is going to be sustainable. Number 2, I would say it's transformable. So as you advance within your career and you see different changes within your career, different emphasis in your career in terms of whether it's research or scientific study, whether it's more advocacy, it's more attention to patient outcomes. The college has all of that. So the college can continue to be there by your side as you continue to grow in particular areas of your career. So I would join the college early and let them be your companion as you go through the different parts of your career. I don't have a third, but those would be the main 2, being sustainable and being transformable.
Yeah, the takeaways for me are similar. I mean, number one, get involved. And there's no barrier to getting involved. You can early on, you get part of a variety of committees. Through the committees, you meet different people, and then ultimately you get put in leadership roles of small subcommittees that become committees that become larger committees, and ultimately you have a good amount of presence and admissibility to larger projects among the college. So number 1, I'd say get involved. And number 2, what I would say is it doesn't have to always just be clinical. The college is very supportive of clinical endeavors on behalf of the patient, a surgical patient, and on behalf of your career. And so there's a lot of resources in that regard, and you can use that, but it doesn't just have to be clinical. There is quality, there is advocacy, there's the PAC and so forth. So there's multiple different pillars of the college. You can pick what you like. If you want to be involved in membership, you want to be involved in health policy, you want to be involved in advocacy. There's a variety, there is multiple options for you to do. So just put yourself out there and you definitely won't regret it.
Great. Any other comments or things that you'd like to tell our listeners?
I would like to just tell the listeners that in an era right now when a lot of focus is on diversity, equity, and inclusion, the college has taken that seriously. The college is moving to make sure that there are no barriers. And for me personally, being involved in the college for, like I said, for almost 20 years, I haven't experienced any barriers in being able to move through different committees, be involved, and feeling comfortable at the meetings. So I would say that in this era where we're discussing it, I think the college had already mastered it for quite some time and are looking not only to just sustain it, but to improve it. And it's been very comfortable and exciting being involved with the college.
I'd like to second that. I think the vision's always been forward-looking. They anticipate the things that are going on, and the college does a really good job of being extremely inclusive, extremely transparent in all its processes, and very equitable. And again, I completely agree with that. They've just been forward-looking, and the things that are occurring now, we've been thinking about. The college has been thinking about it and trying to come up with plans for these previously, and we definitely appreciate that.
I echo that completely.
Well, wonderful comments. We really appreciate you all taking the time out of your busy schedules to join us on this interview. And I know our listeners are going to love to hear your advice and insight and expertise. So thank you again for joining.
Thank you. And congratulations, Dr. Turner.
Thank you so much for having us involved. And again, congratulations.